questions as we can in the time that we have. This briefing, as always, is being recorded, and we will send out a link once it is posted. That usually comes, an hour or so after the conclusion. I do want to start out just kind of by outlining the current COVID-19 situation. I'm sure you all are as happy as we are that the situation has really been steadily improving over the last several weeks. With today's update, we'll be at 4,078 people hospitalized with COVID-19 in Texas, and a 7-day average of 3,156 new confirmed cases. Both of those are the lowest they have been since mid-July. COVID-19 deaths are also coming down, 177 per day reported to us over the last 7 days. As we've talked about before, we always see the trend in deaths lagging new cases by a few weeks. And indeed, we saw that as cases were rising, and we're seeing that now as cases and deaths are falling. Finally, the positivity rate's been falling steadily for the last month or so as well. It peaked back in early August at about 18.5% and started falling. As a reminder, that, of course, is the percentage of each of the PCR tests that come back positive each day. It plateaued a little bit after it started falling around 15%, kind of early to mid-September, then resumed falling really pretty rapidly to the 6 to 7% range, which is where we find ourselves now. So that is all good news, kind of no matter how you look at it. Of course, we always, as always, need everybody's assistance to help keep those numbers moving in the right direction. Best way to do that is through continued vaccination. And with that, that is what we are here to talk about today. I'll turn it over to Imelda Garcia, Commissioner Garcia, with more on what that next phase of vaccination is going to look like for us.
Thank you, Chris. Good afternoon, everyone. It's been a while since we've spoken, but I'm happy to be giving you an update about pediatric vaccines. So here in Texas, we have about 2.9 million children between the ages of 5 to 11 years old, and we expect these children to be eligible to receive the COVID-19 vaccine very soon. So I'm going to share some information about the timeline for the authorization of Pfizer's pediatric vaccine and the plan to getting the vaccine shipped out to providers as soon as the CDC makes recommendations on the administration of it. Now, the vaccine rollout is different from how it was done last winter. The federal government has created a process called pre-order prior to launch. Now, this enables the state to place vaccine orders before the FDA authorization and before the CDC recommendation process is complete. They've asked states to place their initial orders in 3 waves that have slightly different delivery dates. And I'm going to take you through the timeline right now. So this past week, last Tuesday, DSHS, we hosted a provider webinar to review the authorization timeline and explain all the pre-order processes. Then on Wednesday, providers were able to start submitting their requests through our VAO system specific to pediatric vaccines. Later that evening, that Wednesday, the Texas Expert Vaccine Allocation Panel met to discuss allocation priorities. And then finally, we submitted the first 2 waves of vaccine orders to the federal government last Thursday and Saturday. Now, looking ahead at this week, the 3rd wave of vaccine orders will be submitted tonight. And then tomorrow we have the FDA's advisory committee to review the data and are expected to make a recommendation to issue an emergency use authorization for Pfizer's pediatric vaccine. Now, that we should have a final approval from FDA within a few days of that advisory committee meeting. Based on the latest information, vaccine will start shipping out after the EUA is issued. The first wave of shipments will be delivered to providers within 1 to 5 days after the EUA is issued. Second wave deliveries will be within 3 to 7 days of the EUA issuance, and the 3rd wave of deliveries will happen 5 to 9 days after the EUA is issued. Now, looking ahead, right now, CDC's Advisory Committee on Immunization Practices is scheduled to meet on November 2nd and 3rd. Now, it's important to remember that administration of the COVID vaccine can only begin after the CDC director, Dr. Walensky, signs the clinical recommendations made by ACIP. So I'm going to pivot now and talk a little bit about the allocations. So the total amount of pediatric vaccine allocated to Texas is approximately 1.3 million doses. The Federal Retail Pharmacy Program will receive their own allocation and will send doses directly to retail pharmacies across the state. To date, 700 pharmacies enrolled in the federal program have placed orders for 260,100 doses. Now, as the state, DSHS is allocating just over 1 million doses. So when we walk you through the wave amounts for each one, we have 404,100 doses within wave 1, and we were able to accommodate almost all of the requests for the first wave. In wave 2, we're receiving an additional 303,300 doses. And then wave 3, we will receive an additional 303,300 doses. Now, the minimum shipment for these pre-orders directly from Pfizer is 300 doses. And as of right now, 814 Texas providers in 120 counties will be receiving the Pfizer pediatric vaccine in the first 3 waves of vaccine shipping. There are about 134 counties that will not receive vaccine in the first wave of shipments because they did not place orders. Note that this number may change as additional requests come in before we finalize the allocations this evening. We realize that many providers will not need 300 doses, and so we have pre-ordered vaccine that we will break down into smaller shipments. The delivery of these smaller shipments will follow the initial wave of deliveries. So I'm going to go ahead and let our senior scientific advisor, Dr. Saroj Rai, talk about what we know about the pediatric vaccine formulation and administration. So with that, I hand it over to you, Saroj.
Thank you, Commissioner. Good afternoon, everyone. It's good to be with you. As Commissioner Garcia mentioned, the FDA's advisory committee, VRBPAC, will meet tomorrow to discuss the overall safety and efficacy of the Pfizer COVID-19 vaccine. And they will take a lot of time to discuss in details both the efficacy and safety. But overall, based on the results reported to the FDA by the manufacturer, Pfizer, the overall vaccine effectiveness is, for this population, 5 to 11 years of age, is about 90% vaccine effectiveness. The most common side effects reported were pain at injection site, fatigue, and headache. And based on the results reported, there were no cases reported of myocarditis and pericarditis. Now, I do want to just take a minute to discuss the vaccine formulation, because there are some similarities of this 5 to 11 years of vaccine formulation, but there are some very important differences that we want to make sure our providers are aware of. So the similarities between the current vaccine that is known as the purple cap vaccine, so our providers may have this in their refrigerators currently, versus the pediatric 5 to 11 that is about to come is an orange cap vaccine. So the similarities are that both the 5 to 11 or 12 years and older, so the orange and the purple cap vaccines, are both 2-dose series vaccine given 21 days apart. But the differences are the pediatric 5 to 11 years old is about third the doses of the 12 years and older. So the 12 years and older, the purple cap vaccine that our providers currently have in their clinics or offices is 30 microgram per dose. The pediatric 5 to 11 is 10 microgram dose. So it's really important that given the differences in the vaccine doses, and there are some other dilutions and administration concentrations that will be communicated as the vaccine gets authorized, that if our providers have the current purple vaccine in their purple cap vaccine in their refrigerator, that particular vaccine cannot be administered to our 5 to 11-year-old age population. So if providers, you are looking to administer vaccine to this age group, 5 to 11 years old, it is really important that those providers place an order in our vaccine allocation and ordering system for this new orange cap vaccine. And we really want to make sure all our providers who have intentions to vaccinate really order this orange cap. So things to remember: orange is the pediatric vaccine, 5 to 11, purple is the 12 years and older. Thank you. Back to you, Chris.
Thank you very much, Dr. Rai. Commissioner Garcia, that is what we've got for now. Let's open it up to questions. As a reminder, if you'd like to ask a question, please type your question into the question box. It should be on the right side of your screen, unless you moved it around somewhere. Just type that in, type in your question, your outlet, and we'll work through those. We have one waiting now. Kira McCarthy with the Fort Worth Star-Telegram gets the first question. She has, given pediatrician success at vaccinating children against childhood vaccines or against childhood illnesses, how big a role will pediatricians' offices play in the rollout? Is the state reaching out to pediatricians to encourage them to register as vaccine providers?
Thank you for that question. So yes, we are actively encouraging pediatricians that if they have not signed up as a COVID vaccine provider, that they should enroll as a provider. For all of the ones that are already registered, we have been in close communication with them, encouraging them to place their orders within our system to ensure that they get some of the first doses that will arrive in Texas. Our communications will continue to pursue even as we go on throughout the months, throughout the fall. And now with some of the formulation changing, that not ultra cold storage is required, you can keep it in a regular refrigerator for much longer. Hopefully that barrier has provided some relief to providers for them to start considering administering the Pfizer brand as well.
One follow-up from the Fort Worth Star-Telegram. Will the state encourage school-based clinics to participate as well? You know, those offering them in school buildings during school hours. And I think that really kind of goes to, it's really going to be a whole universe of different kinds of providers. But I think, and you can elucidate this a little bit more, Imelda, if you would. But just that we really are relying on the kinds of providers that typically provide care to people in this age group.
No, absolutely. So we have many school-based clinics that have already placed their orders for the new Pfizer pediatric vaccine, and we will continue to encourage them. The vaccine rollout this go around, we really want to leverage every provider across the state that is eligible to receive the vaccine. And so this is where not just relying on one particular set of providers, but really leveraging every single office site that we possibly can to make it easily available is really important.
Next question from Teresa Woodard with WFAA, who is struck by the fact that fewer than 50% of Texas counties ordered the vaccine. Does that present a concern about access? And what type of outreach are you doing to contact the counties that ordered none?
So first, it's important to remember that the Federal Retail Pharmacy is also placing orders against that. And so there will be additional counties that are picked up with that information. And so we just don't have all of that full visibility quite yet, but that number will increase. And it will increase just later today as we pull in those final amounts. Now, one of the things that we are actively doing is making sure that providers know how easy it is. We are doing special reach outs to communities in order to encourage them to place their orders. But most importantly, because we are also sending some to one of the state contracted facilities, even if providers miss this initial pre-order piece, they're still able to place an order within our VAO system for smaller amounts or even larger amounts if they just totally miss the deadline in order to receive vaccine in anticipation of the authorization.
Stephanie Whitfield at KHOU in Houston asked, how are the allocations split up for that first wave? What percentage will go to big hospital systems versus pediatricians? Do we have a sense of that now?
So I don't have the final percentages of that first wave quite yet. I just don't have it in my head right now, but we will provide those numbers to you guys afterwards.
Question from Amanda Chasko. Do you need to register for Tvfc to provide vaccines, to provide the COVID vaccine to children?
It's a very good question. We get that question quite frequently. So you do not have to be a Texas Vaccines for Children's provider in order to administer the COVID-19 vaccine. However, you do have to be an enrolled COVID-19 vaccine provider in order to receive this vaccine. So we do have some Tvfc providers that are not currently enrolled as COVID vaccine providers, and we continue to do outreach to them in order to help encourage them to start offering this particular brand.
One question from Yana Suarez, just to recap the numbers, it probably bears repeating as well, just wants to confirm the number of 5 to 11-year-old children who would be eligible for the vaccine, as well as the numbers allocated at this point by the federal government.
Sure. So we have about 2.9 million children between the ages of 5 and 11 in the state of Texas, and our state allocation was about a little bit over 1 million doses. Now, this is on top of the 260,000 doses that have been ordered directly from the federal program.
That is it. Let's move on here. Scrolling down just a little bit, Monica Madden asks if DSHS is working with TDEM and TEA to set up at-school clinics for accessibility once the EUA is set for more kids. You talked a little bit about school-based clinics that already are existing on campuses, but certainly we'll be working with schools. I think they have a number of options, partners they can reach out to.
No, absolutely. Y'all may recall when the 12 age range was newly added back in May, we worked very, very closely with all the schools in order to help partner them up with COVID vaccine providers that would be able to either bring it on site to them or offer special clinics and times for their populations to be able to be seen there. So all of those relationships are still in place. We are actively working across all of our state partners in order to make sure that the vaccine rollout for this new age group will go smoothly.
A question from Dion Anglin at KVFW. Will there be any coordination with counties to set up community clinics and promote those clinics?
Yes, and so DSHS, not only through our public health regions, but also through our contracted vendor teams, we will be coordinating with counties that may not have placed orders in order to offer the pediatric vaccine within those communities. So those conversations continue to ongo every day, and as soon as we have authorization, we'll be able to get those clinics scheduled.
A couple of related questions, one from John Moritz at the USA Today Network, and one from Andrew Lemparski at KXXV, Channel 25 in Waco, asking about sort of promotion, PSAs. Will DSHS be implementing any outreach programs to educate parents about the safety and benefits of the pediatric vaccine?
So some of our new media campaigns have started to roll out. Additionally, our contracts for community-based organizations are being finalized in order to help bring community-based organizations doing education with parents in order to help fight vaccine hesitancy and really helping make sure there's a warm handoff between communities and the COVID providers. So all of that work continues to it continues to happen across the state, and we will see an increase in that communication here in the coming weeks.
Stephen Epley asks if there will be a tiered rollout for children, for example, children who are immunocompromised, having a greater priority. How are we going to see that? That's sort of what we saw with the initial vaccine rollout, of course, those different tiers, those different categories. What's it going to look like for these younger children?
So ultimately, we'll have to wait to see what FDA and the Advisory Committee on Immunization Practices, what the recommendations come out as, and we will follow the guidance that they are laying out. But, depending on how much vaccine is ultimately available and the vaccine uptake that we're seeing, those priority groups may become more important. However, we'll have to, it's still a waiting game at this point.
But it does seem like, just sort of based on the numbers that we talked about, the supply is not going to be nearly as constrained when compared to the kind of the population that needs to be vaccinated. So to just sort of keep that in mind as we're talking about the numbers and kind of how we're going to move forward. Ariel Placencia asks, the Texas Pediatric Society told me that it's a complex process to become a COVID vaccine provider, which is why some pediatricians' offices have not done so. Are you doing anything to try to make the process easier or simpler so that more pediatricians' offices are encouraged to do it and therefore administer the vaccine?
So CDC outlines the requirements in order to be a COVID-19 vaccine provider. And so as a state, we are obligated to follow the federal guidance. So there's not really many steps that we can do to eliminate in order to simplify this federal process. However, we all want to make sure that we are able to walk them through and help facilitate that along the way in case they do have any issues with any of our systems. We have a call center that handles providers' questions about enrolling, as well as an email box to be able to help triage those things as they come through.
That is the end of the questions at the moment. Might vamp for just a moment to see if any others, and here are some others coming in. Dr. I didn't know if there's anything else you kind of wanted to add about the vaccine in particular, and what particularly parents may need to know about the timing of the vaccine or anything else that they should keep in mind.
Right, thank you, Chris. So as I mentioned in my opening, the vaccine is 2-dose vaccine. So one given at day 0 and then 21 days. So this might be similar to the parents who have received the Pfizer vaccine. So 2 doses two-dose regimen. And as I mentioned, it's really important that some of our family practitioner providers, pediatricians, who will be vaccinating both the 5 to 11 years old as 12 and older, to make sure you have both presentations of the vaccine. So I think I mentioned several times the orange cap versus the purple cap, and it's really important to have that because providers will not be able to use one for the other. So if you have the purple cap, it's only 12 years and older. If you have the orange cap, it's only 5 to 11. So it's really important that you administer that, and it's within 3 weeks. The child can have the second dose, and a couple weeks later, the child will be fully vaccinated.
Thank you very much. A couple more questions have come in. One from Melanie Torrey at CBS Austin. From the data shared, it sounds like DSHS pharmacies enrolled in the federal program are only receiving enough doses to cover about half of the eligible children in Texas. Do you expect this to be enough doses to meet demand? Is vaccine demand for children expected to be lower than it was for adults? And, one reminder that that's just this very initial, that's really the first week or so of vaccine distribution. There will be more vaccine coming later. But Imelda, I don't know if there's anything else you'd like to add to that.
Sure. So CDC in this initial pre-order phase was allocating enough vaccine essentially to cover about 30% of the eligible population across all states. So that's why we got about 1 million doses that were allocated to us in the pre-order phase. So Chris is absolutely correct. We will continue to receive additional weekly allocations thereafter. However, we don't know what those allocations will be. But given the national trend and the research that they have seen, that assuming that 30% uptake, we should be set for at least a little while with that initial 1 million doses, and then adding doses that come along the way for additional providers that want to place orders, but also just for increased demand as we go into the holiday season.
Question from Amanda Chasko, who asks, I'm scrolling up there and I don't mean to be, is the 1.3 million doses both first and second dose allocations? That was something we talked about a lot with the first, back in December, January, February, kind of how many first doses, how many second doses. What's the situation with those in this case?
So this time around, CDC is not differentiating between first and second doses. So it can be for both first and second. We expect that the providers manage first and second dose with what they have on, and then are able to order additional vaccine as they need.
Question from Clayton Neville at WBAP in Dallas. What type of impact will vaccinating this 5 to 11 age group have on achieving herd immunity? How important is the expected emergency approval in the overall fight against the pandemic?
So this new age group is a big factor just in helping us reduce the viral load across the state. The kids, without having a pediatric population eligible as a state, we have so many children across the state that we need to have as many people vaccinated as physically possible. Now, the magical question of the herd immunity and what number does it take to hit that is still under scientific debate. We know that we have exceeded 70% with at least one dose and are over 60% fully vaccinated of those that are currently eligible. But now that we're adding additional almost 3 million children to that, it's a really big deal. And so until we're able to really add all of the children within this eligibility is when we'll really see kind of a bigger wave in that regard to helping us stamp down the pandemic.
Follow-up from Stephanie Whitfield. We've talked about a number of places where vaccine will be available. What's the best recommendation for parents early on as far as where they will be able to find vaccines in these first few days and first few weeks?
So as the vaccine orders are placed either through the DSHS allocation or through the federal retail pharmacy, the Vaccine Finder website is a good place for you to go and look to see who has that particular vaccine. We will make sure that we have all the latest information on our website, but also CDC's Federal Vaccine Finder as well.
And finally, just last question here, one that, a little less technical really, but one from Teresa Woodard at WFAA. What would you say to vaccine hesitant parents about this vaccine? I know you have a child in this age group. I have a child in this age group. What's the word to them?
So what I tell my family and friends is it's not only for my daughter's health and safety, but vaccinating her also protects our extended loved ones. And so for my parents who are in their 60s and 70s, her getting vaccinated helps them as well as helps protect all of the children and other individuals who may not be able to be vaccinated. So it's really important to consider weighing all those things in when you are looking at getting vaccinated. I can tell you that my daughter will be vaccinated, and I'm really excited about that.
And talk, ask questions. You know, I think that's something we've said throughout this is you know, there's nothing wrong with asking questions. That's what you've been doing here today, and that's a great thing for parents to do. If you have questions, talk to your pediatrician, talk to your doctor, talk to the experts around you that you interact with on a daily basis. And it's certainly natural to have questions, and we want people to have those questions answered and have confidence in what the science shows about this vaccine being safe, about this vaccine being effective, not just for you know, adults and adolescents, but for this child group as well. With that, we will leave it there. We are about out of time. Thank you once again for being with us today. Appreciate your attention. Appreciate your sharing this important information with parents. Hope you have a great rest of the week and have a happy Halloween.